Hi there, Dr. Karen Truesdale-Bierman, licensed clinical psychologist. I am so glad you're here. I'm really glad that you found me. Just a little bit about me. I've been in private practice for over 20 years. I've helped many children, adolescents, and families. I've done thousands of evaluations. I do have a heart for assessment, kind of figuring out what's going on and coming up with treatment recommendations. But more recently, over the past 5 years since COVID, I've gotten back into teaching. Back when I was in grad school and when I was a fellow, I used to teach statistics and biostats and psychological assessment. Then that kind of went to the wayside. I was a full-time clinician. And then after COVID, I started teaching workshops on boundaries, grief, ADHD. That's one of my favorite topics, superpower. And then over the past couple years, I've been an adjunct professor of psychology at the University of Houston, Victoria. And I've really enjoyed that. I'm teaching crisis intervention this summer to their grad students, and then I teach during the fall and spring, I teach developmental psychology and then geropsychology, so kind of getting both ends of the lifespan. But welcome to my, to my world. Text me or drop me a message and I'll send you one of my workbooks on, boundaries, saying no, the art of the art of not people pleasing, or the art of saying no. And then I have my grief workbook. I have coping with ADHD, and then healing hearts. I do a lot of reunification from families where a child might have been alienated, which is a pretty specialized line of work, but I do have my healing hearts curriculum. And so all sorts of workbooks, all sorts of courses. I do have communities, and I'm just really glad that you're here. I'm here to help. I'm in the business of transformation, whether it's, overcoming a difficult season, whether it's, coming to terms with a medical diagnosis, or even, a mental health diagnosis like ADHD, kind of seeing that as a superpower and figuring out how to cope, or, families going through transitions or changes, coming out on the other side, or just setting better boundaries, especially for, in the codependent space, which a lot of helping professionals can relate to. So glad you're here. Thank you.